and then I try this microphone. See, I got little green dots that says it's working, you know. I've done all I can, Jade. That's as far as it goes with, I can't hear either. Okay, 2 people can't hear. Great, okay. Okay, not a problem, not a problem. Let's say not a, how do I, oh God, I've got to get that down. Hey, all right, test sounds working. Oh, it's working. Hey, it's working. I haven't done anything. Okay, I'm not gonna quibble. I've got to be honest with you. I do Facebook on a computer with like webcam and microphone and stuff. I do Instagram on a phone, and I never have any problems with Instagram. Never have any problems. Facebook, honestly, it makes me look like an amateur. But which clearly anyone who knows me knows that I'm not. I mean, clearly, it's, you know, and I think after a few minutes of this broadcast, you'll see how professional it is. So I don't know what went on there, but anyway, we'll just say it's all good. I vowed I wouldn't say, can you hear me? But then I've got to start, you know, you wonder why I say that at the beginning of everyone, because it so often doesn't work. But anyway, don't touch it, right? I ain't touching nothing. I'm just going to touch this, which does that, which, see, this is the thing about Facebook. Got the question there on Facebook. Can't do that on Instagram yet, but hey. So this is question number 1, by the way. When having a breast lift, what happens with aging? Do the scars start to pucker? I'm imagining a gathering either side of the scar. Is this so? What I mean is I'm 48 now, and I am wondering what will happen in, say, 10 years' time when my skin has aged. I've got to be honest, I'm not entirely sure what, I can't picture this. The scars puckering, I'm imagining a gathering either side of the scar. Not getting that. I don't really, no is the answer. The scars don't tend to pucker. Maybe they're thinking the scar's really tight and then this breast sort of droops around it and puckers around it. Anyway, the answer is no. In fact, if anything, in terms of the scarring, aging is good. Aging means the scars settle, means the scars soften, and scars are often quite red, they're often quite firm, and they do tend to soften over time. The only, and fade in color over time, so they tend to go skin colored and soften. The only thing that I can potentially think of in this gathering thing, I can't get my head around the gathering, but is potentially if you had a really tethered scar, and if it's really tethered deep and the skin around it drooped, if you like, or sagged, then maybe that could cause some issue. But you don't tend to get tethered scarring with a mastopexy, with a breast lift, because you're not really going deep with the incisions. The only time you get tethered scarring is when the scarring is going deep down to the muscle and deeper. Things like abdominal surgery and what have you, when you're going down through all the layers of the fat, through the muscle, and then into the abdominal cavity, then you might get tethering of the scar down onto that muscle layer, or down deep onto the fascia, so that you get this big dent. And then I guess if the tissue sagged around it, that might be an issue, but that's not an issue with breast lift. So no, you don't tend to get puckering. Breast lift is, in terms of the scarring, only gets better with time. Now, the cosmetic result is another thing, because your breast will sag or droop over time with gravity. That is going to happen. So just the fact you've had a breast lift doesn't mean that you're not going to have potential for drooping over time. But what it does mean is you're restored to a better place, and so the sagging and drooping isn't as bad as it would have been if you had not had the surgery. So the surgery is good from that point of view, but it's important to be aware that you may still, well, you will still age over time. Right, so I think that's quite clear. It's working now, working. All is good. Don't touch it. Joanne's got a question. Good one. Nice, Joanne. Can I get that? I thought I could get that question on the screen. Oh, good God. I was sure. Show. There you go. Show. Yep. See, I told you I know what I'm doing. Hashtag Ask JJ. Like your style. Do you recommend Hibiscus scrub before surgery? And for breast augmentation, do you recommend the use of compression socks afterwards? Very good. No and yes. So I do not recommend Hibiscus scrub before surgery. It's, yeah, I mean, I don't think many people do. I mean, there's Hibiscus is a sort of is an antiseptic wash that we often, you know, we use to it's chlorhexidine. We use it to wash our hands when we're doing surgery. But no, it's not really something that's necessary. I think as long as you wash normally before surgery. We will prep your skin before the surgery, so we will wash with antiseptic your skin. But I don't think there's any evidence that I know of to say that you need to wash yourself in Hibiscus pre-op. I don't think there's any benefit in doing that I know of. So no, I don't do that. Never have done that. And for a breast augmentation during the compression socks, yes. So compression socks is after any surgery, really. It's a thing for DVT. So you often have flight socks, you know, same sort of things to prevent DVT. Now, breast augmentation is not a high risk for DVT because it's quite a short procedure. It takes about an hour, but nevertheless, there is a risk there. So we do wear compression socks, but anytime there is a risk of DVT in terms of any immobility, of which obviously there's immobility when you're lying in surgery, then the main thing I say to people is to walk and to move. So keep your ankles moving, keep your hips moving, your bum, you know, keep taking deep breaths, and basically get up and walking as soon as you can. That's really the best thing for DVT. Compression socks are good as well, but walking is good and moving about is good. So, yep, very nice, Joanne. Nice early Ask JJ in there. Very impressed. What do we got? What have we got? I tell you what we got. We've got a photo. Right. Why is my birthmark not suitable for surgery? So, I can show this. What? Why is it? Oh, it's okay, guys. It's okay. I'm sure I saved it. Right. I'm sure I had it on. Okay. So I'm going to show the birthmark. God dear. I tell you, this is right. That's the birthmark on Facebook. I'm hoping Instagram's still there while I just went away there. I don't know if you noticed Instagram to try and get. Are you having a laugh? To try and get the photo on Instagram. The other photos come. Okay. This is how you tell the professionals how they cope when things don't quite according to plan. No, I don't want to post it on Instagram. I just want to. So, okay. Anyway, it's a photo of a birthmark on a cheek. Instagram. I'm really sorry about this, Instagram. There's another photo coming in a minute, and it is saved on my phone, but this photo hasn't saved. So I'm not. I've got to be honest. I was really excited. I was really excited about showing this photo, and I can't. Anyway, what a nightmare. What a nightmare. Right, we're gonna have to go old school on it. The other one, I'm going old school. I'm going old school Instagram. Can you see it? Can you see it? Is it good to do that? I don't think it's good to do that, is it? It's a bit rubbish. Can you see it? It's just a dark mark on the cheek like that. I don't know if you can see it. Anyway, I don't know what I've done now. I'm trying to show a photo. I can't show a photo. Thank you. See you on the table in 35 days. Oh, Joanne, yeah. Joanne, the surgery's fine, okay? So don't worry about this. Don't let this put you off, okay? All this Facebook Live stuff, okay? Just, I'm fine with the surgery, all right? It's just the Facebook Live with all the photos and stuff is a little bit of an issue, but yeah, 35 days. I'm counting the days. I've got them on the calendar. Insta is paused. Oh my God, Insta is paused. Is it? I was messing about with the photos. Instagram, are you paused? I was trying to show you the photo. Anyway, it's just a dark mark on the cheek like this. And this birthmark, it's showing on Facebook. So if you're on Facebook, guys, oh, that's no good, is it? No, so it's not paused. I'm assuming no means it's not paused, because if it was paused, you wouldn't have written no, would you? So it's fine. So yeah, so it's a dark mark on the cheek. And the reason this is not suitable for surgery is because the only thing surgically that I could do for this would be cut it out. And if I cut it out and give a big scar, there's no question that is going to be more obvious than the birthmark. So it's just a slightly bit of hyperpigmented skin. So the skin is a little bit darker than the surrounding skin. So actually it's quite subtle. It's flat, it's not raised, it's not dented. So when you're taking bits of skin away, you've got to think, am I going to do something better by taking this bit of skin away? And I've got to be honest, in this instance, I think the answer is no. I don't think it would be better by cutting that out, because I think there is a lot of good things about that birthmark. It's not too obvious. It's flat. As I say, the pigmentation isn't significant. I don't know if there's anything non-surgical that would be appropriate. It will be something that I think it would be worth talking to someone about. I mean, there are things like depigmentation agents, which are things that can take some color out of the skin. You have to be a bit careful, because you obviously have to take just the right amount of pigmentation out. So if you take too much out, then it goes pale, and it's hard to give it back again. So it's a tricky one. It is a tricky one, but in a way it's good that it's a tricky one, because it's not, the birthmark's not too obvious. So focus on the positives, and I don't think surgery will be a good way to go. Instagram, I can only apologize, you can't see this photo, but you're going to see the next one, guys. So hang on, okay? Hang on. If you've got a cup of tea or something, don't go yet, because there's another photo coming. All right, so I can tell you're excited. I should perhaps leave it till later to show this photo, because yeah, maybe I should. I was watching, it's all marketing techniques. Did you see Megan last night? As soon as it started, I'm not going to tell you the sex of the baby until my husband comes later on. Keeps you there. I'm learning. So I say to Instagram, stay, because there's another photo coming. I should have probably done the photo later, but it is actually the next question. So anyway, stay till now, because there's a photo coming, guys. Now, Facebook are used to the photos coming. So why is my tattoo not suitable for surgery? So I'm just going to show that on Instagram. So how's that, Instagram? What do you say about that? That's what I'm talking about. That is the sort of thing we want, yeah? So why is my tattoo not suitable for surgery? So the two things about tattoos are the size and the location. So a big tattoo in a good location might be suitable for surgery, and a small tattoo in a bad location might not be suitable for surgery. So you can do a big thing on the tummy because there's loads of spare skin, you can cut it out. So it's size and location. It's not just size. You can't really say a tattoo of this size is suitable or this size is not suitable, because it depends on the location. So this is actually a very small tattoo. It's just a little tattoo on the finger. But the location is really bad. The skin on the finger is really, there isn't a huge amount of laxity in the skin on the finger. And if we choose to cut anything out of the finger, we would cut it out in an up-down direction. We would give you a scar in an up-down direction, so that when you make a fist, you're not pulling that scar apart. You're not putting tension on the scar, because this is the problem. A lot of things, and particularly on the hand, people often say, oh, I've got loads of spare skin. Look at all this spare skin I've got on my hand. And you're like, yeah, but you've got spare skin on your hand because your hand needs to move. As soon as you make a fist, all that spare skin goes. You've got spare skin there, but you haven't got spare skin there. So you've got to make a fist. You've got to move. And same with the finger. The finger has to move. So you would take it out in a side-to-side direction on the finger if you were choosing to make a scar. So when you have things like tattoos, you can't really choose the orientation of the scar, because this tattoo is clearly orientated in a sort of horizontal way rather than a longitudinal way, and so you would have to make the scar that way. And two problems with that: one, the laxity is not as much in an up-down direction, so although it's, you might say it's tiny, you would really struggle to close that. You would really struggle to close that. That would be really tight, and that would be really tight with a hand like that. That would be a really tight closure. I don't know if you would get it all out. There seems to be some letters, I don't know if it's a word or if there's some letters which are slightly longer than others, and certainly towards the end there's a sort of L or something, and that might not all come out. So you might end up with a scar with a bit of ink on either side. But the other worry is that scar will be under tension. So the worry is that when you make a fist, that scar will sort of potentially pull open. So you'd have to be really careful. So, it's often the case that it's not necessarily not suitable for surgery, but surgery wouldn't necessarily be high up on the list of options. And sometimes we do take things out which are not maybe not suitable. Double not, maybe suitable. Not suitable. That's suitable then. Sometimes we take things out that are suitable. No, we always take things out that are suitable. Sometimes we take things out that are not suitable. Anyway, sometimes we take things out that are not suitable. Yeah, that may not be suitable for surgery. But I would always say, to be honest, with all tattoos, I would always say, is anyone there? I lost. I would always say laser first, and I'm going to say it for this one, laser first, because this would be really tight, quite uncomfortable, and also potential for wound dehiscence, wound breakdown. So for those reasons, this is not a great example of a tattoo that would be suitable for surgery. I'm sorry to say, and I know that's disappointing to hear, but I would go with laser first and see how that goes. Because if laser works, then it's usually the best way to do it. So I'm just going to get rid of the just get rid of the picture there. Yeah. And so Anna's confused. What are you confused? I don't blame you, Anna. Is it about the not suitable? Don't worry about that. Basically, what I was saying is sometimes you do things which may not be ideal for surgery. If patients have tried laser or are really desperate, you might say, given all the things I've just said, that it'll be really tight and it might break down, you could cut them out. I think that's what I was trying to say, Anna. But do you know what? I put these. I don't know why I put myself through this, Anna, because I put these on YouTube. We chunk them up and put them on YouTube, and honestly, the comments I get really terrible, waffling, go to 3 minutes 14 for the answer because he's waffling, honestly. And God help us if we put this one on YouTube with a not suitable. We'll cut that out on the edit though, I think, because I can't be doing this negativity. So yeah. Right, let's get on to some of this, shall we? Want a bit of this? If I wanted my implants removed, could I still have a natural breast lift? The other thing I've been told off about on YouTube is commenting on comments while I'm answering the questions. So I've got to be mindful of that. I've got to be responsive to feedback. So what I'm going to try and do now is maybe not look at the comments and just answer the question, and then maybe look at the comments, because I can't. It's probably all right in a live Q&A, but on a replay it probably looks a bit odd if you want to know the answer to the question and I keep on saying what, not paused, what, I'm confused. So anyway, so I'm trying to be better, trying to be a better man, aren't we all? So that's all you can do. If I wanted my implants removed, could I still have a natural breast lift? Not sure what a natural breast lift is. It's the word natural that's thrown me off with it. If it just said, if I wanted my implants removed, could I still have a breast lift? Definitely, yeah. I mean, the thing about removing implants is that the implants have added volume to your breasts and that have therefore stretched the skin. and so your breasts don't go back to how they looked before you had the implants. So it's something to sort of bear in mind, I guess, if you're having implants, especially if you're having big implants, that those implants are going to stretch the skin. So if one day you had decide to have them removed, your breasts won't look like how they look now. They will look like how people look when they get pregnant, when the breasts get big and then small, or lose weight, the breasts get big and then small. Both those things stretch the skin, and so that makes them droop slash sag slash require a breast lift. So having breast implants, especially large breast implants, for any period of time can have the same effect and can make the breast droop if you were then to have those implants removed. So it's something to be aware of. And I often say, I mean, obviously it depends on a case-by-case basis, but my advice is often to see what you think, you know, because it's quite a big undertaking to have a breast lift. So often I would say, look, why don't you take the implants out, see how you go, the skin might recoil, you might be happy. But sometimes people say, look, I'm not going to be happy, I know I'm not going to be happy. And so in that case, when you do a breast implant removal, you can do a breast lift at the same time. So that is perfectly reasonable to do a breast lift at the same time as implant removal. A natural breast lift, not sure what that means in terms of a natural breast lift. A natural breast lift, does that mean non-surgical breast lift? Or does that mean just natural looking? Or does that mean like some kind of, I don't know what natural breast lift is. I need a bit of context for that. But breast lift often gives you a normal, natural shape, and that is one of the limitations of breast lift, to be honest with you, because whilst it's quite full to start with, it settles to what I would say is a more natural shape, a bit of concavity in the upper pole. And I always stress to people that is the case, because when they're having a lift, I think they might think they're going to stay up there, but they're acted on by gravity. So they often settle to what I would say is a natural shape. So I'm going to say that's what that question means. I'll still have a natural breast lift. So yes, you can still have a natural breast lift once you've had your implants removed, either at the time of implant removal or at a later date. So look, I've seen stuff going on Instagram, but I haven't said anything because I didn't answer that question. So what's going on here? Surgeon source. Hey JJ, me and you need to do a joint live to discuss your belly buttons. There you go. Discuss my belly buttons. I'll discuss my belly buttons anytime. Yes, very happy to discuss my belly buttons. Very important part of abdominoplasty, belly button. You know, let's not underestimate it. It's one of the things about plastic surgeons. We do tend to make a big deal about little things. And I think other surgeons probably think, you know, we're a bit funny because like they're busy like taking stomachs out and, you know, doing all big things. And we're like fiddling about with, you know, belly buttons and earlobes and nipples and, you know, spending ages trying to do little tiny things. And I've got to be honest with you, it isn't one of my things, a belly button with a tummy tuck. Yeah, I think it's really important. I spend a lot of time on it and I do it in a particular way. So yes, thank you. And always happy to discuss my belly buttons. There's quite a lot written about belly buttons, you know, quite a lot of papers on it. So you'd be surprised. So including mine, obviously, but yeah, there's quite a lot of others as well. Yeah, I think, what's that? Hands up, Caprine. Yeah, hands up. My BB is perfect. Thank you, JJ. We've got a perfect BB on Instagram, guys. It's official in black and white. What is going on here? What is this? Can't wait to see my final result. Steady on, Cat. You gotta wait. You gotta give time. Gotta give it time. Now I am talking at least six months, 12 months. But yeah, it takes time for that scar, especially scar can be a bit tight around the belly button, so it takes time to get in there, get massaging. Lowry J22. Oh, hold on a minute. I'll put a question up here. Let's do the Instagram one. What determines a mini tummy tuck or a full tummy tuck, please? Also, who needs muscle repair? Okay, good. Linked questions there, Lowry. Linked questions. So very not straightforward, but very sort of clear the difference, you know, a mini and a full tummy tuck. So a mini tummy tuck, as far as you're concerned, Lowry, is less than a full tummy tuck. So a lot of people, when you talk about mini tummy tuck, you say it's less scarring, less downtime, less cost, less complications. You'd be like, yeah, I'll have a mini, thank you very much. But also less of a result. See, that's the thing, because less skin is removed. The reason people need a tummy tuck is they've got too much skin. The skin has been stretched by something, usually pregnancy or weight loss. Those are the two things that usually do it. Same for breast lift, you know, same for a facelift, same for most body contouring surgery. The skin has been stretched by something, and the classic for a tummy tuck is a pregnancy or weight loss, and so you've got too much skin. So you need to remove that skin. So the whole concept of short scar or minimal scar body contouring is difficult to reconcile, because a lot of body contouring involves removing skin and tightening that skin. And so a mini tummy tuck is a shorter scar. So I don't know if you've got a cesarean scar, but if you know where a cesarean scar is, a mini tummy tuck is the same place as a cesarean scar, but slightly longer. And that's it. That's the only scar that you get. And what you do with a mini tummy tuck is you take that bit of tissue above where the cesarean section scar is, which is basically the top of the level of your pubic hair, and you take a sort of wedge, a sort of melon slice of skin and fat above that to tighten the lower abdomen. So you tighten the abdomen from the belly button down. So a mini tummy tuck only really works on the bit of the abdomen from the belly button down. It tightens if you've got a bulge below your belly button. And it's often the case that people have a tethered cesarean section scar, a bulge above it, and a mini tummy tuck will address that. But it doesn't really address anything to the sides, and it doesn't really address anything above the belly button, because you can't get it above the belly button because the belly button is a fixed point. So you're only removing a little bit of a tissue below the belly button. I've got to be honest with you, there's not the majority of people are candidates for full tummy tucks rather than mini. A full tummy tuck is a scar in the same place, so where a cesarean section scar is, but it's much longer. It goes from hip to hip. So it's a much longer scar, therefore much more of the abdomen. So you can go right further out to the sides with a full tummy tuck. And also a full tummy tuck takes all of the skin from that place where the cesarean scar is, from the top of your pubic hair to above your belly button. It takes all of the skin from your pubic hairline to above the belly button. All that skin gets removed. And so you make a cut round the belly button, you take all that skin away, then you pull the skin that goes from your rib cage to your belly button. So that's all the skin that's left, the skin from the rib cage to the belly button, because all the skin from the belly button down has gone. So that skin that goes from the rib cage to the belly button then gets pulled down and meets the incision at the bottom. And then you make a hole in that skin, and then the belly button pops back out again. So your belly button doesn't get removed. You cut around it, it drops inside, you close the skin, make a hole in the skin, and then it pops out again. And so therefore you have a scar around the belly button as well. So there's no scar around the belly button when you do a mini tummy tuck. So that's how you tell the difference. A mini tummy tuck has got a longer scar on the lower abdomen and also a scar around the belly button. No scar around the belly button for a mini, because you're not going anywhere above the belly button. Now, who needs a muscle repair? Now, part of having children or having weight loss is putting tension on the abdomen and the abdominal musculature and the rectus abdominis muscles, which is your six-pack, are two muscles which go straight down the middle. And sometimes when you have children or you have put on weight, you have a lot of intra-abdominal fat, and those muscles splay apart. And people talk about repairing the muscles. You're not really repairing them. They're not damaged. The muscles are usually fine, but they're just a bit far apart. And you can tell this by lifting your head and shoulders up off the bed or doing a straight leg raise. Both of those will tense that rectus abdominis muscle. And if you put your hand above your belly button and feel for a gap between those muscles when you tense them, sometimes you can see it. If you lift your head up, you can see a gap. So that is what repairing the muscle involves. And it's for people who've got a gap that you repair it. Now, you might not know so who needs the muscle repair? You know, no one needs it. Who needs a tummy tuck? No one needs it. But you know, you can live with excess skin in your abdomen. You can live with the muscles apart, but you might not like the bulge there. You might not know it's there. So if you don't know it's there, then you don't need anything done. But to be honest with you, most people having a tummy tuck do have some degree of repair of the muscles, or bringing the muscles together again. We call it repair. We shouldn't really call it repair. It's bringing those muscles closer together again. So people sometimes refer it to as a hernia. It's not a hernia. It's actually called divarification of the recti muscles, or diastasis recti. Those are the official terms for it, but basically what it means is the recti muscles a bit further apart than we would like, and we can just use a stitch to bring them back together again. So, and that can only be done with a full tummy tuck because you're getting above the belly button, because you're coming around the belly button and dissecting all the way up to the rib cage. With a mini tummy tuck, you're only doing a limited dissection in the lower abdomen, so you can't really repair those muscles with a mini tummy tuck. Someone might pull me up on that. I hope there's no plastic surgeons out there, because there is a thing where you can sort of try and repair the muscles with a mini tummy tuck. So I should put a little star there saying you can't repair the muscles, because there is a thing where you can, but I've got to be honest with you, I found it extremely difficult. You've got to float the umbilicus, you've got to cut underneath the umbilicus and try and get up there from this incision down the bottom. I found it very hard personally. So in my hands, should we say, you can't repair the muscle with a mini tummy tuck. But anyway, I think there are people out there who get these retractors and go guddling out and try and go up there. But the problem with floating the umbilicus is then you can't have a full tummy tuck later on, because obviously you cut round it, it'll just fall off. Sorry. It's one about waffling. I probably waffled too much there. But Lowry says thank you, so I'm fab. So I did all right. So stop waffling. No waffling. Straight to the point, guys. Not messing about. Tracy, why do we need our belly buttons? We don't, Tracy. We don't need our belly buttons. Why don't we just hide it and pull the skin right down so we don't have it anymore? Absolutely, Tracy. You can just throw it in the bin. And if you're doing what we would call a toilet procedure, so someone who's got a huge abdominal apron, who's very ill, who's maybe not having trouble breathing, really in a bad way and needs it for health reasons. They have rashes and intertrigo in the fold and very difficult nursing and things. So in those situations where you're just taking that abdominal apron, so-called apronectomy, you may well just throw it in the bin and just forget about guddling and trying to fix, repair the belly button stuff. So it's perfectly reasonable to just throw the belly button away, Tracy. It is purely cosmetic, Tracy. So we don't need our belly buttons. They served a purpose when we were attached with the umbilical cord, when we were in the womb. But ever since then, we have not needed them, and we don't need them. And you will live a long and happy life without one. And I've had someone, I'm just thinking about it now, who wanted them removed. Sometimes you can remove them, basically. So, and sometimes they can die when you do a tummy tuck. That is a risk when you do a tummy tuck. The belly button can die. Now you can reconstruct belly buttons, but it doesn't sort of matter apart from the cosmetics of it. The abdomen might look a bit not quite right without belly button, but it's purely cosmetic, Tracy. Purely cosmetic is the answer. So yeah, I do think that it frames the abdomen, and I do think at the end of the day, abdominoplasty is usually a cosmetic procedure. It's not that sort of toilet one that I was talking about with people with large aprons. It's usually a cosmetic procedure. People who want to feel good and look good in sort of swimwear and things. So I think most people are want it, because if you walk down the beach and you didn't have a belly button, people might think. But not essential at all, and absolutely fine not to have it. I've seen people talk about an internal bra with a reduction. Is this something you offer? If not, why don't you offer it? That's a bit aggressive. Bit aggressive, isn't it? Yeah, I've seen people talk about it too. I did a blog post on it a while ago. Google Staiano internal bra. You'll find it. Yeah, not just with a reduction, but also with a lift. So basically a reduction and a lift are the same operation, although a reduction removes volume, whereas a lift does just remove skin. And it goes back to what I was saying earlier about the lift, and how it settles to a natural shape, a natural lift. I think a lift does tend to settle to a natural shape. But what I mean by that is less fullness in the upper part of the breast. People mean different things by natural. So it's one of the important parts of the job is to get a handle on what someone means by natural, because pretty much most people say they want to be natural. Very occasionally you'll get someone who says, I don't want to be natural, I want enormous. Very occasionally. Most people say they want to be natural, but people mean different things by natural, because I'll show them photos and I think, oh, they look a bit droopy. I'm like, yeah, but they're natural. That's what natural breast looks like. And they're like, yeah, but I don't do that now. I want to be a bit fuller up here. I'm like, okay, that's fine. You don't want to be crazy full. You don't want to be crazy fake, but you want to be a bit fuller. So a bit. That's why a while ago, that's the other thing. Ages ago, I did a blog. I thought it would take off. Genuinely, I thought this was it. I thought I am made. I did a blog, and I introduced the term the supernatural. Huh? See what I've done there? The supernatural breast augmentation, saying how people say they want to be natural, but they actually want a little bit more fullness up there, not so much as maybe an extra high profile implant, but maybe sort of the moderate high profile round implants, which give a bit more fullness than the low profile and the teardrop implants. And so I thought supernatural, yeah, I was really happy with that. Was not a goer. Was not a goer, as you can probably tell because you never heard of it, have you? I could say I first coined the supernatural breast augmentation. That was me, but it didn't take on. I spoke to some, well, I say some, and journalist, and I said, look, I got this, supernatural breast augment. She's like, nah, just sounds a bit like witchcraft and things. I'm like, what about the vampire facelift? That came on, that took off. I mean, the vampire facelift is worse than the supernatural breast augmentation, isn't it? I could be known for the guy that does the supernatural breast augmentation. Anyway, no use crying over spilt milk. Right. Oh God, this is what we're talking about, waffling. Internal bra. So yes, so you've got to be careful and you've got to be clear about what you mean by natural. So, and that's why I don't go to lengths to show people photos of before and afters of people who've had breast reduction to give you an idea of what sort of shape you can achieve with a breast reduction. Because whilst it's quite full to start with, supernatural even, it settles to a more of a concavity in the upper pole, out of a bra. And again, make it clear, these are the photos that I show are out of a bra. So when you take your bra off, you do get that settling and you do get a concavity in your upper pole with a breast reduction and a breast lift. If you want sustained fullness in the upper pole, if you take your bra off and you want it to stay fuller in the upper pole, if that's the shape you want, if you want that supernatural shape, only available here, no, it's available anywhere, but anyway, you cannot get that with your own breast tissue. And that is one of the huge limitations of mastopexy and breast reductions. The volume doesn't stay, and we're always looking for ways to keep the volume up there because people do often want a bit more volume up there. They don't want it to set, they don't want a concavity. They want a little bit of either flatness or convexity in the upper pole. And so, especially if they're having a breast lift, they're like, hold on a minute, I don't want it to settle, I want it to stay. And that is the problem with breast lifts and breast reductions. And that is what, maybe not the holy grail, but it's a huge thing that we're trying to address, and lots of you have tried to address. And the internal bra has been around for a long time, and that's what the internal bra is trying to do. The internal bra is some kind of mesh, some kind of prosthetic material that goes into the breast to hold the tissue up, to support the tissues, and to hold it up and to stop it from settling, to keep it up there. And that is in theory a very good thing. And in principle, if someone said, I've got this thing and it keeps it, I'm like, oh, thank goodness for that. Hallelujah, you solved the problem that's been around for ages. In practice, there are some issues with it, in my view. Now, I don't do it, so you could argue that I'm biased. So you should get a balanced opinion and talk to someone who does do it. I'm not, to be honest, I don't know anyone who does it, but there probably maybe some people who do it. And the issues with it are, number one, is prosthetic material. So a bit like an implant is prosthetic material. So you've got to be a little bit careful when you're using prosthetic material. When you're using prosthetic material, which means basically not host, it's like a foreign body, you're putting a foreign material in there. If you get an infection in that material, you have to remove it because the infection is cured by giving you antibiotics which travel in your bloodstream, and the foreign material doesn't have a bloodstream. An implant doesn't have a bloodstream. So if you're talking about something like a breast implant, they're usually relatively simple to remove. It's a bit of a disaster, no doubt it is, but they're relatively simple to remove. If you've got a mesh or some kind of device in there which has embedded itself in the skin to hold the breast up, it can be a little bit difficult to remove. I say it can be, I never have done it. So that's why don't listen to me. That's my worry. I would worry that would be a bit of a nightmare to have to remove it. So that's number one thing. Number two thing is you've got to anchor it to something, because if it's not anchored to anything that's going to stay, it's just going to droop with everything else. So you've got to anchor it to something that's not going to move. So you usually anchor it to the bone, so to the ribs. And you can get a bit of complications with that. You can get pain. You can get it pulling out and then drooping. So there are issues of the breast drooping even despite it, and also concerns regarding the infection. And also it's a bigger operation, because you often have to do a lot more dissection in order to get the mesh in, to get the internal bra in. So I don't offer it. I don't think it's quite there yet in terms of the risk profile versus the benefits, in my view. But the thing about plastic surgery, it is very subjective, and the surgeons will all have their own views, and there may be someone out there who does do it, and so you're probably better off talking to them to get a sort of probably a better opinion, quite frank, because they've been doing it and they can tell you the pros and cons of it. But that's the reason I don't do it and I don't offer it. And to be honest, as I say, I don't really know many people who do. It hasn't really caught on, although, as I say, the principle is brilliant, but I think in practice it's not quite there yet, in my view. Tracy Bell, can you give breast implants a stitch to keep projection? Now, breast implants normally don't need to stay in place. Breast implants normally don't move. Now, you can get breast implants moving, obviously, and you're descending and migrating and bottoming out and all sorts of things you hear, but that's a complication of a breast implant. So ideally, if you make the pocket right in the first instance, then ideally you don't get problems with breast implants. Now, back in the day, they did used to make them with little tags on them that you could actually put a stitch in to keep them, but they don't make them like that anymore. So they haven't got any, you wouldn't put a stitch in it because you would pierce the shell, and then it would compromise the integrity of the shell. So you don't do that. As I say, they did in the day have a little tab on them, but actually if you make your pocket right and you position your implant right, it's just going to stay there. That's what I mean about having sustained fullness in the upper pole. Implant will just stay there. And then in terms of malposition, if implants are not right, it can be difficult to treat those problems if the pocket's been made too big and you get a synmastia or bottoming out or something like that. But that's where polyurethane implants really do come in, because polyurethane implants do stay where you put them, so they're very good in those situations. But yeah, they don't make those little tabs anymore, so no, you can't put a stitch in a breast implant to keep projection. Nice thought though, Tracy, and it has been thought of by the companies before. So believe it or not, 2 photos, not much waffling, I think you'll agree, and some internal bra type lift questions. And that's me out. So I'm out of questions now, full disclosure. It's 7:48, so we should still be able to get the second episode of Antiques Road Trip, although I can hear that someone's watching television next door. So if they're watching YouTube, I'm not going to be happy, because I do this. I'm normally 7 till 8 and 8 till 9 on Antiques Road Trip, but obviously I forsake that on a Tuesday night for this, because clearly this is far more important. So if you've got any questions, we've got 12 minutes before Antiques Road Trip second starts. But if not, I might go and watch the auction of the first episode of Antiques Road Trip. Unless anyone's got any questions, I'd be happy to ask them. No? Okay. Oh, hold on, Tracy. Tracy's in. Oh, Jackie says, Jackie, what a staunch supporter, Jackie. Oh, I was going to try and wave at you, Jackie, but that wasn't a wave. Thank you, Jackie, because you are single-handedly keeping the numbers up. Not single-handedly with all the others, but that is thank you, Jackie. Tracy's come in with a last-minute one, good one. I have implants, and having them changed and having a reduction with smaller implants, can my pocket be made smaller? Yes, it can, Tracy. Yes, indeed. So I said to you, if you have a problem with the pocket, so obviously your pocket will be bigger if you're downsizing your implants. Polyurethane implants are really good, but you don't have to get a polyurethane implant. You can stay with silicone implants. So if you do have a pockets too wide or too high, or if you're just downsizing, you can close down those pockets. Absolutely, Tracy. And you can use, well, not you, the doctor can use you usually do a limited capsulotomy, assuming you haven't got a significant capsule, because if you've got a significant capsule, they might do a total capsulectomy. But assuming the capsule's not really hard, then the capsule being the scar tissue that forms around the implant. If the capsule is not really hard, then they'd probably do a limited capsulectomy to sort of take that bit of capsule out and then stitch the pocket down to make the pocket smaller. And you would normally, I would normally sort of focus on the lateral aspect of it to try and maximize the cleavage area. But yes, that's absolutely fine, Tracy, to close those pockets down. And no, they wouldn't be able to stitch the implants themselves, but if they make the pocket the right size for the implant, which is what you always aim to do, particularly with silicone implants, then that should be fine. So yeah, closing the pocket down will be absolutely fine. Good question, Tracy. Glad I stayed on for that. Wouldn't want to leave you hanging with that one. Liz has come in with an Ask JJ. So, you know, big yourself up, Liz. You've got yourself an Ask JJ there. When having a TT, tummy tuck that is, sometimes the scar is so low it's on the pubic line. Are ingrowing hairs likely to cause infections? You can get problems with the hair growth because it can interrupt the hair growth, and you can get problems with the stitches causing infections, localized infections early on. So obviously the good thing about putting a scar in a sort of hairline is that it's more hidden. But the bad thing is, yes, potentially in terms of localized infections with the hair follicles, there is an issue. But on balance, I think it would be better to put it in a hairline. We try not to get, well, I try not to go too low into the hairline because you want to take where the redundant skin is normally higher than that, and you want to take the maximum amount of redundant skin. So you don't want to go right down into the hairline, because obviously the lower you go with the lower incision, the lower you can go with the upper incision, if that makes sense. There's a certain amount you can take out. You can't just sort of take. So you've got to be a bit careful because you've got to be able to close it. And the paradox is someone who hasn't got as much skin on their abdomen, you know, if they haven't got a huge amount of laxity, your scar might be a bit higher because you've got to go above the belly button for a full tummy tuck. That's fixed. So if you can only take, if you can take less fat out, the lower incision is going to be higher, if that makes sense. I don't know if I'm losing you on that, but so you don't want to go too low is my point. You want to take where the redundant skin is. But fair point about the localized infections if going through hair follicles, but it's not normally a big problem. Localized sort of mini-like infections, you don't normally need antibiotics and things, is not uncommon with abdominoplasty, but mainly also because of the dissolvable sutures we use, which can cause little bits of localized problems, but it's not normally a big deal. And as I say, it'll probably be better to get the scar hidden. Blimey, we've got another question in. Look at this. We've had a run on. Jade, do breast implants need to be replaced or taken out after a certain amount of years? No, Jade. I'm glad you asked me that. That's a good question. A lot of people say they've got to be changed every 10 years. Where'd that come from? Where'd that come from? Who said that? So they haven't got to be changed every 10 years. I don't think it's unreasonable to sort of have that in your mind that you might need to have it changed at 10 years. But at the same time, it's not like at 10 years you've got to like, oh, hello, Jade, 10 years, can you come and have your implants changed, please? You know, you don't have to have them changed every 10 years. They're built to last forever. All the ones we use have got a lifetime warranty. The manufacturers make them so that they're supposed to last forever. They usually don't last forever, I'll be honest with you. You probably will need them changed at some point in your life, particularly if you're young. And so you should be aware of that. And the main thing you're going to need them changed for is capsular contracture, which is hardening of the implants. I guess the two things are capsular contracture and rupture. Rupture is less common, but capsular contracture is hardening. So rupture would be changing the shape and usually some kind of trauma, and capsular contracture is hardening of the implant. And you don't have to have it changed if they go hard. So they might go hard at 10 years, but that doesn't mean you have to have it changed. In fact, I always tell people the longer you leave it, the better, because if you change it, you're going to get another capsular contracture, because basically capsular contracture is just scar tissue. And if you change it, you have to cut all the old scar tissue out, which is the total capsulectomy, put a new implant in, which is a more traumatic operation than the first operation. So a capsular contracture comes quicker second time round. So you always want to delay your second operation as long as possible. So the 10 years is a no-no. It doesn't have to be 10 years. If you've got a problem, then you might need to have them changed, and that can happen 5, 6, 7, 8 years, or it can happen at 15, 20 years. If you haven't got a problem, then they don't need to be changed. I mean, I offer everybody a yearly appointment, and I keep an eye on everybody in the clinic. Personally, I don't routinely scan people because I don't think that's helpful in the absence of any symptoms or signs. So that's where I am on it, Jade. But obviously, if you've got implants in, I would say talk to your surgeon who put the implants in, etc. You know, because they might have a view on it, and it depends slightly different with the different types of implants. But what I've just said is true about the capsulectomy and the capsules needing them changed. But some implants I like to last longer than others. I heard that before 10 years. Yeah. So if you've got, did you say you've got implants? I can't remember. I can't keep track. No, it was Tracy who's got implants in. But if you've got implants in, then don't worry that they've got to be changed every 10 years. If you haven't got implants in and you're thinking of having implants, then be aware that they might need to be changed every 10 years. I'm not saying they don't. I'm just saying that it's not written in stone. They have to be changed bang on 10 years. But be aware if you're young, you may well need another operation because they may well go hard in the future. Tracy back in the house. What's a good product to buy to help heal scars? Well, healing scars, Tracy, there's nothing really that's particularly good at healing scars. Most things heal with your body does it, to be quite honest with you, Tracy. We just keep them clean and put a dressing on it and the body does the job. But in terms of scar maturation, so once it's healed, so the scar's usually healed in 4 to 7 days. But once the scar's healed, then it can often be quite red and it can be quite firm, and you might need things to help it to mature and soften, which is in the first, 3, 6, maybe even 12 months. And for me, it's massage and moisturize. I don't particularly recommend any cream. I think we sell a cream, a moisturizing cream, but there's nothing particular about that. Moisturizing cream, E45, Nivea, aloe vera, aqueous cream. If you've got a moisturizer that you normally use, I would go with that, and just a bit of pressure to moisturize and massage your scar. So there's no particular thing that you can particularly use that will help to heal or to mature the scars. If you get a problem scar, then that's slightly different. So a problem scar will be something like a hypertrophic or a keloid scar, which is a red, raised, unsightly scar. So that's an abnormal scar. So if you do get any signs of abnormal scarring, red, raised, lumpy, firm, then that's different. There are things like silicone is usually the first. Massage too can help, but silicone often helps with those. Silicone sheets or gel. I think some people use silicone sheets and gel on sort of normal scars. I'm not sure what the evidence is for that. I think that the evidence is stronger in the hypertrophic keloid scar arena, because most sort of normal scars will settle on their own anyway, although they take many months to do so. But problem scars, you can get silicone products, which is either a gel or a sheet, but that's really reserved for hypertrophic or keloid scars, which are red raised scars. And there are other things you can do for those types of scars, but most scars is just moisturize and massage, and keeping away from the sun, because you don't want to get the sun on an active scar, because otherwise you'll get pigment in it, end up with a brown scar. XHLSH Heart Mom. Sorry, what's the best to do first? Breast implant uplift or possible redo tummy tuck to sort out flabby mons out, then go and watch your program. XXL Heart Mom, don't worry about my program. It's okay. To be honest, I've seen most of them. It's such a downer when it starts, think, oh, I've seen this one. So don't worry about it. I'm okay, to be honest, about the program. Yeah, a lot of people say that. What's best to do, tummy or breast or whatever? Do you know what? It's what bothers you most. And I don't know if I think this in my head. I don't often say it to patients, but I think in my head, what if you had a problem? So what's the problem? So you're looking at breast implant uplift or possible redo to sort out flabby mons. Let's say you had a redo flabby mons operation and you had some wound healing problems and it was all a bit of a nightmare, and you thought, I don't want to have another anesthetic, I don't want to have another operation. Would you be really disappointed that you didn't get your breast implant uplift? And then flip it the other way and think, what if I did my breast implant uplift and had a really bad time and I thought, I'm not having my mons flabby done? So think of it that way. So basically whatever bothers you most. I don't think there's anything to say you should have your abdomen first or your breast first. I think it's whatever bothers you most. I would go with that one. I mean, you can have them both done together, and maybe, I'm not sure how much of an abdominal thing that involves with the mons, because we are limited in terms of doing stuff both together. We can't be doing it on a case-by-case basis, because we've got to limit the time in surgery. But But if you're having them done separately, there's no, I've got no view about you having one done. I would do the thing that's most troublesome first, and then the other one, whichever one that is. So that's helpful. Okay, feel free to come back at me. Come on. Come on. No, you don't have to come back at me. That's all right. Oh, thank you. I'm talking to you tomorrow evening anyway. Oh, but what? Good. No, I'm all for that. As you can see, you know, let's bump up the questions. Definitely. Oh well, I'll try and save something for tomorrow evening, and so I'm not try and give you something new to think of. So good. I have TS joined. So yeah, so that's me. If anyone's got any questions, feel free to Instagram me, Facebook me, YouTube me. Don't ever go on YouTube. Come on, give me a break. You know, doing my best here. No unscripted. It's all unscripted. This, you know, got to think on my feet. And I'll see you next week, Tuesday night, 7 o'clock, same time, same place. And in the meantime, get yourself on channel 17. Really, bit of Antiques Road Trip. I'm gonna get myself over there. All right, Kat, take it easy. Oh, sorry, my thumb's in there. Take it easy. Bye. End the video. Facebook, take it easy.